We are going to continue with respiratory system part 2, focusing on the two main process, that is external respiration and internal respiration to start with. So if you guys recall from our earlier lectures, external respiration implies when you exchange gases between the alveoli, which basically is your lungs, and your bloodstream. If you look off from the circulatory system lecture, we bring in the oxygenated blood and we take away oxygenated blood as a part of the pulmonary circuit. Now, when we're talking about this, as I told you earlier, there are three main pressure numbers that you guys do need to remember. And you also need to remember that the gases always move from a higher pressure to a lower pressure. So when we're talking about the pressure of oxygen, the two numbers that you guys need to know is either 100 or your other option is 40, and the units, because it is pressure, is millimeter of mercury. And when we're talking about carbon dioxide, pressure of carbon dioxide, your two numbers are either 40 and 45. So the point of these numbers are this. If you have a deoxygenated blood, it means it is low in carbon dioxide, it means it's high in carbon dioxide if it's deoxygenated blood, and therefore the option that we will be choosing is the 45 millimeter of mercury. For pressure of oxygen, when the blood is oxygenated, your pressure of oxygen would be higher, so you would be choosing the number 100. Again, if the blood is deoxygenated, it means it's low in oxygen, so your option would be 40. So, let's take a look at this process. The pulmonary arteries are going to bring blood that is deoxygenated into your lungs. Now remember, it is deoxygenated, so the option for oxygen would be 40, and for carbon dioxide would be high, so it would be 45. Now your lungs has brought in oxygen through the process of inhalation, which means you're going to have high pressure of oxygen, which is your 100, and it's going to be low in carbon dioxide pressure, so your number chosen is 40. Now think about this logically. We always say that movement of molecules, gas molecules, are from higher pressure to lower pressure. So oxygen is 100 compared to 40, so oxygen is going to move into your blood vessels. And carbon dioxide is 45, and inside the alveoli it's 40, so it moves from high to low again, so from your blood vessels into your alveoli. So the blood that leaves would be high in oxygen, so we choose the number 100, and low in carbon dioxide, which is 40, because there are only two options for them, right? Now this is an oxygenated blood, which means it's going to return back to the left atrium using your pulmonary veins, the 4 pulmonary veins that you have coming into your left atrium. Now this blood is eventually going to be transported down to left ventricle. From the left ventricle, it's going to go to the aorta and pump through your systemic circulation. Now systemic circulation will be basically allow the gas exchange between your tissue and your bloodstream. So when you think about systemic circulation, you bring in your blood using your aorta, right? Aorta coming from your left ventricle. This is oxygenated blood, correct? So it means it's gonna be high in O2, so your pressure of O2 would be 100, and low in carbon dioxide, so your option would be 40. Now, tissue, on the other hand, is continuously using up oxygen, and therefore is going to be low in oxygen, so your number would be 40, and high in pressure of carbon dioxide, because it's continuously producing carbon dioxide, so the number would be 45. So oxygen moves from high pressure, 100, to low pressure, 40, and carbon dioxide moves from high pressure, 45, to low pressure, which is 40. So the blood comes in as oxygenated and leaving as deoxygenated. So deoxygenated means low pressure of oxygen, your option is 40, and high pressure of carbon dioxide, which is 45. Notice again that you're using the same number, so you just need to remember that if it's deoxygenated blood, you're gonna use the high number for the CO2, which is 45, and low number of O2, which is 40. And these are pressures. Remember, these are pressure. In a case of oxygenated, you would be using the low CO2 pressure number, which is 40, and high oxygen pressure, which is 100. So blood comes in through your aorta, introduced into your systemic circulation, and then moves out through your either superior or inferior vena cava and return back to the right side of the heart, and again goes through the pulmonary circulation from there. This picture that you see right here is basically what I described to you. It puts both of the system, both external and internal respiration both together, which kind of helps you understand the whole system, circulatory system working closely with your respiratory system to make it possible to move gases and provide your cells with necessary oxygen. Now, the other point of this lecture is when we have a concept of matching the amount of air that is within the alveoli to the amount of blood that comes into that alveoli to be oxygenated. So we're going to use two vocabulary for that. One of these vocabulary is ventilation. Ventilation is the amount of gases that are reaching the alveoli. Well, I'm not talking about respiratory ventilation, I'm talking about just simple ventilation, which is amount of gas that is reaching the alveoli. On the other hand, what we have is the process perfusion. Perfusion is the amount of blood flow to the capillaries. So, keeping that in mind, we can have two scenarios. You can have a scenario where you have little bit of air inside the alveoli, but as a result of that air, but you have a lot of blood circulation to that tissue. Or you can have a lot of air inside your alveoli, but little bit of blood coming into that tissue. So if you have a little bit of air with a lot of blood, that's ventilation less than perfusion. And if you have a lot of air in your alveoli, but not much of a circulation, that's a scenario called ventilation more than perfusion. So let's review each of the scenarios. Ventilation less than perfusion. So notice here that you have an alveoli, and this alveoli is not fully filled, it's kind of saggy or deflated. But what you notice is that the blood vessel that's coming in is relatively open, or is vasodilated basically. So you're bringing a lot of blood into this alveoli, but notice that it is basically not going to be oxygenated because there is not enough air into this space. So what is your solution? You can change your ventilation because that's the air that's already in there. So your solution is to cause vasoconstriction. You constrict your blood vessels, so you make it smaller, and that allows to match the ventilation, the amount of air in the alveoli, to the blood vessel, which is your perfusion. So if you have ventilation less than perfusion, then you limit the amount of blood or circulation to that part of the lung or that alveoli. Now, opposite is true. Notice in this scenario that your alveoli is really inflated with air, right? Which means there's a lot of air coming in, a lot of oxygen. But what you notice is that there is the blood vessel that is coming to this alveoli, to this capillary network, are relatively small. Which means you have the air, but not enough blood supply to be oxygenated. So what's your solution? You dilate the blood vessel, so you go from a relatively small diameter to a much larger diameter of the vessel, which means now that you have a lot of air, you're also going to bring a lot of blood vessels into that area to be oxygenated. And that is a scenario, again, when you have ventilation being greater than perfusion, you dilate the blood vessels to match ventilation with perfusion. Now, the next concept I want to talk about is transport of the two main gases that we keep discussing. Your two gases were CO2 and O2. So in this slide, we're focusing on carbon dioxide. Carbon dioxide is going to be moving or transporting in your bloodstream using as a most effective mechanism, will be using bicarbonate, HCO3, to be transported from your tissues into your lungs. So this is the equation of your life for now, and it will be reviewed again in the urinary system as well. So if I ask you, how do you move carbon dioxide? What is the most effective way of moving carbon dioxide? Your answer would be as what? Bicarbonate. And that is the main way of moving it. Now, there is the other 20% is going to be moved using the globin component of the hemoglobin. This is the part of the lecture we discussed in your blood lecture. So relatively a small amount of carbon dioxide is going to be moved with globin. And notice that it says there is no effect on the oxygen ability to bind with your hemoglobin. So even if it has the carbon dioxide, it's not going to affect how it's binding to oxygen. And lastly, it's about 10% is going to be dissolved inside your plasma. Now, because the main goal of this lecture is so the main part of this lecture is the 70% that you're going to be transporting, 70% of carbon dioxide being transported as bicarbonate. That's what we're going to be focusing on. So it seems really confusing, but just try to follow it. So right here, I have my tissue, right? Tissues are going to produce CO2. CO2 is going to move into my bloodstream, and it's going to go inside my red blood cell. So the picture looks clear. This is your red blood cell. So CO2 gets combined with water, and it becomes what? H2CO3. H2CO3 is known as carbonic acid. And to change CO2 and H2O to carbonic acid, I need an enzyme called carbonic anhydrase. This is an enzyme. So when you form carbonic acid, which is H2CO3, it can be broken down to bicarbonate, HCO3 minus, and hydrogen ion. So now you have two components. Now, remember that there is no room for HCO3 minus, so I want to push it out. So HCO3, which is your bicarbonate, gets pushed inside your plasma. This is the light color is the plasma. And because I'm removing a negative charge, I'm going to shift chloride as a negative charge inside. So there would be basically the balance, the exchange. So bicarbonate goes out, chloride comes in. Now we still have the hydrogen. So the hydrogen is going to be combined with the hemoglobin and form HHB. And then you're set. You can transport the bicarbonate using your plasma, and you eventually reach your alveoli. So this is basically, you pick up the carbon dioxide on the top picture. Now you want to drop off the carbon dioxide. So carbon dioxide on the top was changed to bicarbonate. So I need to change bicarbonate back to what? Back to CO2, so I can basically exhale it out. So notice this picture right here. Same scenario, basically the same reaction in reverse. I'm going to bring in bicarbonate from the plasma back into the red blood cell, and I'm going to shift the chloride out. I'm going to release the hydrogen from my hemoglobin, so hydrogen comes back, combines with the bicarbonates, and it becomes what? Carbonic acid, H2CO3. Same thing as what we have up here. The enzyme carbonic anhydrase is going to break down carbonic acid to H2O and CO2. And now CO2 can be diffused back into the alveoli and basically exhale out. So this is an extremely important reaction. You do need to remember that again, carbon dioxide plus water form carbonic acid, and carbonic acid gets broken down to bicarbonate and hydrogen. Hydrogen stays inside and becomes hydrogen hemoglobin. And if its hydrogen is moving out, it gets replaced by chloride. As bicarbonate moves into your plasma, it gets replaced by chloride inside your red blood cells. And this is known as the chloride shift. The reaction, the process, the terminology is identical, guys. The only difference is the arrows that are moving. If you're talking about gaining carbon dioxide, bringing in carbon dioxide, the reaction is ending with each HCO3. And if you're taking and you want to exhale out the CO2, you start with HCO3 minus and you end in with carbon dioxide. Okay, I'm going to end this PowerPoint and then we'll continue with hemoglobin affinity curve in your next PowerPoint.